Oh yeah, we got a cracker. Oy vey. Okay, Jacob, what brings you in today? What's going on with your body?
My lower back and my hip hurt, I guess. Yeah.
Okay. So is it your left hip, your right hip?
Mostly both hips, I'd say.
Okay.
Probably because how I sit at work and stuff. My belt and everything that I wear.
How heavy is your belt that you wear?
Like 10 pounds, 10 or 15 pounds.
Okay.
Yeah.
So you're in the, you're a sheriff?
Yes.
Okay.
Right.
Thank you for your work that you do.
Yeah.
We need you. So being seated with a heavy belt, you find that your low back is starting to get aggravated. Any other area?
No, not really. Just my hip. That's it. I have a bad shoulder, but that's about it.
Okay, what happened to your shoulder?
I used to play baseball when I was younger, and I tore like a little bit on my rotator cuff, so it hurts every once in a while.
Okay.
Yeah.
Are you right-handed or left-handed?
Right-handed.
Okay. So when you say hip, I want to know exactly where it is. So go ahead and go ahead and stand up and point.
It's mostly
to the
my
area.
right hip, so it's going to be like right here.
Okay, so that's kind of right in your actual hip joint.
Yeah.
And that has been bothering you for how long?
Maybe about 6 months now.
Okay.
Yeah.
Right in that point.
Yeah.
Okay, so we want to rule out that could be bursitis. Bursitis is when you have a little cushion, like a pillow, on top of your bone, and your muscle, which turns into the tendon, rubs across that. So if it gets irritated and you have bursitis, inflammation of the bursa, it'll create little fibrils and attach to that tendon to keep you from moving it. So do you find that pain is more painful first thing in the morning when you haven't been using it? Or is it painful all the time? Does it?
I'd say more when I'm been walking a lot, at work and everything. Like at the end of the shift, that's when it probably. Okay,
because bursitis tends to, when you don't use it, it's most painful because you have to start breaking up those little fibrils versus overuse. Okay, so you probably have inflammation in there. With Jacob, I talked about maybe his hip pain could be bursitis. Bursitis is very common. But his didn't seem to be bursitis because it didn't fall into that category. However, everybody's different, and we're not all textbook. That's something that, if his pain persists, we would want to go a little deeper into getting imagery to rule out the bursitis. I'm going to do a couple things on you because you said this is your first time adjustment.
Yeah.
Woo! How exciting. Are you nervous at all?
No, not really.
Okay, good. I'm going to have you stand for me right here, looking out the doorway. Okay, so now what I'm looking at is just symmetry in your body. And I'm going to have you touch your toes if you could.
Can't do it all the way.
Yeah, it's okay. Do you have any pain in your low back or anything? What I'm looking for is make sure your back is even, that we don't have one rib hump higher than another. You seem to be fine. Go ahead and stand up. Take a little step forward so you can put your hand on the doorway. Put it low. Okay. I'm going to have you bring your right knee to your chest and down, and your left and down. So your left moves greater than your right side. So we'll take a look at that. Okay, come on in. I am going to lift the table up and then we'll have you go face down. Now you can put your hands to the floor, please. Okay. Anything that I do that makes you feel uncomfortable, just let me know. So your right leg is longer than your left. Bend. I'm going to just use my hands to kind of feel as I work my way up your spine. We said your right leg was long, so now I'm going to look here at your ilium. Here's your right, here's your left, so it's a little lower. Do you have any pain or dysfunction in any of these vertebrae here?
Yeah.
Okay. That whole area?
Yeah, the last one you touched.
Oh, so that's more L3. Okay, I'm going to work my way up. Yeah, you have some tension up in here too, right there. All right, now let's specifically go back down below. And you're feeling it right there?
Mm-hmm.
Okay, let's come to the left. Right leg long. And you feel, tell me your hip that you feel it in again? The right side.
Yeah.
Do you roll your IT band on a regular basis?
Nah.
Okay, so your IT band, iliotibial band, is like a tuxedo stripe going down your leg. And that is tendon webbing, almost like an uncooked chicken breast. You see that opaque layer on top of it. It doesn't have a lot of blood supply. So this can get tight and then it wraps around in here. So I'm going to flush that out for you today before we do any adjustmts below. Okay?
Right.
Okay, so I'm going to release your iliotibial band going up and then across the upper glute. So I'm going to start in your knee. And I'm going to work my way up to your hip. Is there any tender spot in there that you're feeling?
Like right lower, the lower part.
Okay. I put the towel over your skin because I have these knobby balls that kind of gnarly. Oy vey! Uncle! You okay?
Yeah.
I know, it doesn't feel the greatest. Do you have a foam roller at home?
Yeah, I do.
All right. Well, we're going to teach her how to roll the IT band and your upper glute when you get done off the table here, and I want you to start doing that at home at least 3 times a week. You're making me work for this. Oh. You know, I think about this IT band, you know, as like a brittle, cold stick of gum.
Yeah.
The only way you can get movement in it is by putting pressure, massaging it, bringing the blood around it. And the best thing about this is as soon as I stop torturing you by putting pressure in it, the pain doesn't linger.
Yeah.
So it's like tenderizing a piece of steak. You're doing good. I mean, I've had grown men tear up. Okay, I'm going to have you flip over to the other side. You have 2 of them. We don't want this side to be left out. Just as tender or not as tender?
Just as tender.
Yeah, unfortunately. I feel like I need leverage. right, you're doing good. You have a high pain tolerance?
Yeah.
You could have been a Navy SEAL.
No, they're crazy.
I know. Just the things that they put them through. I saw a training once. Not live, but on TV where they're in freezing cold water all night, getting pounded by the surf. All right, just a few more. Okay. All right. As you can tell, Jacob's a pretty big guy, and I got him to grimace. Kind of crazy. Iliotibial bands are one of those things where you don't even realize how tight they are until you start stretching them out. So when I was rolling out his IT band, oh, that poor guy. Fortunately, when I stop, the pain completely goes away. But remember to flush that IT band and roll it as often as you work out. You will see a world of difference. So again, to reiterate, as you can see, his right leg is longer. His right actual hip joint, somebody who knows where their hip is, we released that IT band. His L3 is tender, so we're going to adjust that, but I'm going to work my way down from up higher. Okay? And when you're at work, am I naive to say that A, you have to sit, and B, you have to have your belt on?
Yeah.
Can't be caught walking around without all your tools. I'm going to have you take a breath in, exhale, just relax. Good. I think I need WD-40 on my table. All right, let's do that again. Breathe in and out. There we go. How do you feel about your first adjustment?
Good.
Yeah, not bad?
No.
Not too scary?
No.
Good. I tend to scare people. All right, one more. And out. There we go. Okay, so here, I'm going to bring you up again. And everything can pretty much be done with you laying on your left side. I'm going to scoot you a little more forward towards me, right there. I'm going to take this arm, pull this out from underneath you. I don't want you on your shoulder. Hand on hand. Bottom leg is straight. This knee is bent. All right. This is a cheerleading pose. Just kidding. I'm going to have you take a breath in, look behind you towards the window, and breathe out. Good. Nice. All right. You got a big crack there. All right. We're going to roll you over to the other side. All right. Oh. Oops. He remembered the position. All right. Big breath in. Look over your shoulder. Good. Breathe out. So it cracked before we even put any pressure on you. Flat on your back. Okay. Straighten your legs for me. Yeah, good. Do you stretch out your legs often?
Not often, no.
Holy wow. You are tight.
Yeah.
So, I would say, how often are you working out?
I'd say like 4 to 5 times a week.
Okay, and you're doing weights and
Yeah.
okay. Give yourself at least 10-15 minutes of stretching your muscles. Okay? Start implementing that now.
Yeah.
You're young and your body's strong, but you want to keep all your joints flexible. Yeah, your hamstrings are so tight.
Yeah.
Bend. And out. Across. Okay. Where are you feeling that?
My head.
Yeah. So, this is your piriformis stretch.
Mm-hmm.
You have a muscle that attaches from your sacrum, below in your glute, across your glute muscle to your hip. And your sciatic nerve pierces through that. So it's good to stretch this out. Okay? So a lot of times, when your foot flares like that, that means that that muscle's tight when they pull out. So I want you to implement that.
All right.
Okay?
Okay.
I'm going to look at your upper back, shoulders. I know that you have a rotator cuff problem.
Mm-hmm.
What I'm going to do is not going to affect your rotator cuff. And then we'll get to the goods of your neck.
Okay.
All right? So I'm going to place my hand underneath your scapula. This is going to come up right here. Relax your shoulder. All right. And that one's seated in place. Did that cause a little discomfort?
No.
Okay. Let me place my hand underneath this one. This is going to come up. Down. Good. Oh, hi. That one already cracked before we did anything. Do you feel like you're being watched right now?
A little bit.
All right, just relax, breathe. I'm not going to do any funny business. I'm just going to massage that muscle right there that I feel that is super tight and palpate your neck. Yeah, it's all on your left. Do you feel a difference?
Mm-hmm.
So I'm going to start with doing a little test on you and stretching out your muscles before we do anything, okay?
Okay.
So the first stretch is just opening up this muscle here. I'm going to do this side. Okay. And the test that I'm going to do is I'm going to drop your head backwards and disconnect it. Disconnect. Go ahead and open your eyes. Do you feel dizzy or lightheaded?
No.
Okay, we're going to do the other side. Do you feel dizzy or lightheaded?
No.
All right. So I had a patient once. He was like CIA, and I went to adjust his neck and whoosh, grabbed my hand. He's like, "Nobody touches my neck." He's like, "They taught us never to be in that position, too vulnerable." but you can trust me. Okay. All right, I'm going to have you just relax. Good. And can you wiggle your toes? Oh, yeah, we got a cracker. How does that feel?
So good.
Good. All right. Let's see what else we have in there. All right, Jacob, just let that relax. Nice. How you doing?
Good.
All right. Let's bring you upright, see how you feel.